Good afternoon. Dr. Ann Zink. Today is Sunday, April 12th, and I'm providing a brief update regarding COVID-19 in the state, as well as a few comments about a path forward. Regarding COVID, over the last 2 days, we've had a total of an additional 26 cases. 11 of those were announced yesterday, and 15 are being announced today. That brings our total case count to 272. Of the new cases over those last 2 days, 14 are from Anchorage, 1 from Craig, 3 from Fairbanks, 1 from Ketchikan, 1 from Juneau, 1 from Girdwood, 1 from Palmer, and 4 from Wasilla. We've had a total of 2 additional hospitalizations over the weekend, 12 people who we considered recovered, and unfortunately 1 death. To each of those people who have recently been diagnosed, hospitalized, and to the family and friends of those who have passed away, we send our love and condolences. This can be a very scary time in the midst of a world pandemic. We spent a lot of time over the weekend thinking about what the path forward looks like. We know nationally people are talking about this, and many people have been talking about this with their friends and family. And it seems appropriate to talk a bit about that on today, a day when that's Easter, and we think about renewal and we think about a path forward. The reality is when this all began, we had a couple different choices. One, we could let the disease spread across the state. Estimates showed that we would have had over 11,000 people and potentially more who had passed away. We know that this would have affected every single Alaskan in ways that are uncountable. We also knew that it would be very hard to shut absolutely everything down, and so we chose this middle ground of trying to slow things down as much as possible. With that, we have seen some significant changes. We in Alaska have seen that you truly have changed the path of this disease. We have seen that as Alaskans, we can change this curve and we could flatten the curve significantly. That didn't come without significant sacrifice on many people's part. And we know that and we recognize that. And looking forward, we have to figure out a way that we can do this to minimize the harm and loss of life to everyone in Alaska. When we're thinking about a path forward, I think about what we've been able to build over the last 2 weeks. We didn't have much testing capability in just a short time, and even over the last week, we've been able to build significant testing capacity within the state. I'm hoping over this next week we have much more. With this flattening the curve, we've been able to get additional personal protective gear throughout the state, as well as try to figure out ways to manufacture it on our own, as well as order it from additional places. We've been able to build our healthcare infrastructure, look at alternative care sites, as well as build up our public health infrastructure. We've been able to get every day closer to a treatment and potentially a vaccine and a cure. The sacrifices Alaska has made over the past few weeks are monumental and have made a huge difference and will continue to make a difference moving forward. But this pandemic isn't done. It didn't go away, and it's going to continue to spread around the world. The reality is very few of us have seen this disease, and it's going to affect us all in different ways. We're still learning things every single day, and we really have a choice as Alaskans on what we do about this disease moving forward. We have a choice to be able to allow it to run through our community again once we lift restrictions, or a choice to be able to keep it at bay. But that's really going to depend on Alaskans. It's going to depend on how patient we are. It's going to depend how resilient we are. It's going to depend on our ability to think about the world in a different and new way. What ways can we grow our own food and have it delivered? What ways can we be able to make sure that those who are more vulnerable are cared for? What ways can we have our businesses work online or by delivery instead of in person? The reality is, after every pandemic, every war, every major challenge to our society and our infrastructure, we can either decide on how we respond to it, like we did with World War II, where we figured out how to build new gear, how we were able to mobilize an entire economy to be able to respond to the challenge. Or we can let it destroy us. We can let it pick us apart and find ways to fight amongst each other. Alaskans are incredibly strong. We are able to rebuild after the ground that we stand on shakes with an earthquake and destroys our buildings and our roads. We're able to be strong and resilient across huge, vast landscapes amongst hard and challenging conditions. And I believe in the next few weeks, it's going to be up to Alaska to find ways to respond. So each of you, this is your challenge for the next week. Find ways that you can think about the world differently. What ways can you respond to this pandemic that makes Alaska strong and resilient? What ways can you help make face masks for a loved one? What ways can you stand to the grocery store and hand them out so people can be protected? What ways can you think about your business being done differently? We're going to all make mistakes. I've made mistakes and I will continue to make them, and I apologize for each and every one. All I want is for Alaskans to be healthy and well together. But that's going to take all of us. It's not going to be up to the federal government. It's not going to be up to the state government. It's not going to be up to your local county or community. It's going to be all of us pulling this row together and being able to figure this out together. We truly are stronger together, Alaska. And so with that, love your family, call them, talk to each other, find new ways to be strong and resilient together. I hope you want to have a wonderful Easter for those who celebrate, And for those who don't, I hope that you found peace and joy on this day. I'll continue to keep you updated as much as we possibly can. Thank you. Take care.